Today on Real Pilates, we're going to talk about the abdominal layers. There are 6 layers. Let's talk about the deepest one, the transverse abdominis. That transverse abdominis is very deep inside. It's underneath all the other ones, and it runs basically horizontal. It starts here at the top of your belly button, your xiphoid, and it goes past your belly button to the pubic bone, and it wraps around. So it really has a lot of support to the ribs, 7th rib and 12th thoracic rib, but it acts like a girdle, and it helps pull the belly in along with some of the other muscles, and it really helps you support the arch of the low back, known as the lordotic arch. That transverse abdominis interdigits and talks to and works together with pelvic floor that we're going to talk about separately. The best exercises for that transverse abdominis are pelvic tilt C curves, because you start that muscle sequencing at the deepest layer of abdominal muscles. Other things that are really good are just contracting your stomach and pulling it all the way in as tight as you can without using the breath, just muscle contraction. The gym rats call those doing hollows, where you suck your belly in, or just wear a bathing suit or like a little crop top, and you'll be sucking that belly in all day so that you look your best. Planks and exercises where you hold a position where the muscle is not really changing its length are not as effective for that muscle in particular, contrary to what the mainstream people are saying. The people that do biomechanic studies of the body have discovered that you want to do a muscle movement that changes the length of the muscle as an isometric contraction when you just make a muscle, as opposed to a plank where you just stay there and it's an isometric contraction where the muscle does not change length. This is Pilates Master Nikki, and I'll see you soon for another layer of Real Pilates. Today on Real Pilates, we're going to talk about some abdominal layers that are super deep and in the bottom of the abs, called the pelvic floor. So if we think of the abs like a coffee can, there's a top, there's a bottom, there's a front, there's a back, and then there are the sides. So that pelvic container, the bottom of that is the pelvic floor. And on that pelvic floor, all of the organs of the body sit, except for the heart, which is hung on the 9th rib. And of course, the diaphragm is hung from the base of the heart. So the pelvic floor is super important to help you with things like incontinence, contracting, and holding your needs there, your urinary needs. Pelvic floor is also super critical for breathing. So every time you take a breath in, the diaphragm sucks downward so that the air can be filled into the lungs, and the diaphragm pushes up against pelvic floor. Without really many people being aware, pelvic floor is very important for men as well, because pelvic floor helps with their erections. A lot of erectile dysfunction is caused by weak pelvic floor of men. It's not all blood flow. There is a series called the Rectus series, has nothing to do with erectile dysfunction, which is a series that runs from the tip of your jaw down the bottom, all the way past pelvic floor to your tailbone. As you know, we have those little extra spine bones that stick out called the coccyx or the tailbone. So every time you move your jaw, that last little vertebra does a little bit of movement, and pelvic floor is stimulated. That is a series called the Rectus series. Pelvic floor is super important to keep tone and to keep strong. Pelvic floor that's too tight can cause problems of low back and knee and other things. Pelvic floor that is too loose can cause digestive organ problems, breathing problems, erectile dysfunction problems, as we discovered. You can strengthen your pelvic floor. Pilates does do that. But if you want to do additional exercises, you can do those contractions. So for a second, pretend that you have to tinkle and you want to squeeze and hold that tinkle. So that would be a direct pelvic floor movement. Or pretend that you have to pass gas, like, ooh, and you're squeezing. So try to squeeze both of those at the same time and hold and then release. Hold and then release. In the beginning, you can do contractions that are a second or two long, and you can do like 3 sets of 10. As you get better, you want to do shorter, quicker contractions of pelvic floor, and you can blend those movements. You can do sets of longer ones that are 1 to 2 seconds, and then short, quick, little split-second ones. Every time, let's say, there's a red light, see if you can do 10 pelvic floor contractions, or every time you're waiting for an elevator. Nobody will know you'll be doing them in clandestine. This is Pilates Master Nikki, and I'll see you real soon for another layer of real Pilates. Today on Real Pilates, we're going to continue to talk about the abdominal layers. The layer we're talking today about are going to be the internal obliques. So the oblique muscles, the internal ones, are the deeper ones, and they run contrary to your hand going in your pocket. They run that way, so that they run anteriorly to superiorly in a diagonal, it's called. Those oblique muscles run from the pubic bone, and they really contain all those waist muscles that help you with side bending. When you contract both sides of those internal obliques, they help you with forward bending. When you contract one side, those obliques assist with side bending. People think that to strengthen the obliques that they should do holding weights and just do those side bending exercises. If you try to do just pure side bending exercises loaded with a lot of weight, you lose the V shape of the waist and you start to thicken those fibers, and you actually make your waist thicker. For to really access and strengthen those internal obliques without bulking out, we add other ranges of motion, which is what I always do when I'm teaching in class, that we blend movements. So we'll do a turn, a side bend in C curve, a side bend with a rotation, and other things like that. Those internal obliques also assist with breathing and help separate the ribs. So when you breathe in, those ribs come up and out of the way so that the soft tissue of the lungs can fill with more air. Remember, more oxygen you get in each breath, the higher the metabolic resting rate becomes, meaning you can eat more and it will show less. This is Pilates Master Nikki, and I'll see you real soon for another layer of real Pilates. Today on Real Pilates, we're going to continue to talk about the abdominal layers. The layer we're talking about today are the external obliques. So the external obliques run on the sides of your body in the direction of your hands going in your front pockets. The external obliques are different than the internal obliques in that when you contract both sides, right and left, they help in bending the body forward. But when you contract just one side of the external oblique, so let's say I just contract that right side, the left side of the internal oblique assists the external oblique. I know it sounds confusing. It's really not once you start to see the mind's eye of this picture of these obliques. The obliques that are on the external really help with spine stability, and they can help always with the breathing and the spacing of the ribs. Fat that collects over these external obliques, known as the love handles. Those external obliques, even though you may have a little bit of fat on them or not, are still functional underneath there. If your external obliques are too tight, it can create pelvic problems that your hips start to become in the wrong position, and that affects pelvic tilt, which we're going to talk about in later classes. But those external obliques are super important for stability of the pelvis and of the back. We work those all the time when we do class, when we add blending of movements so that we can sequentially strengthen the muscles. So when I contract one side, let's say that I contract the left external oblique, I'm also contracting the right internal oblique. So as one side shrinks, the other side expands, opening the ribs there. As the ribs attach frontally, they also attach into the spine in the back. So the contraction of the oblique muscles, both external and internal, have an effect on the spacing of the vertebral discs in the spine. So the health of these side bending muscles are critical for correct posture and breathing. This is Pilates Master Nikki, and I'll see you in class. Today on Real Pilates, we're continuing to talk about the abdominal layers. We're going to talk about the top of the abs, the most superficial, the six-pack, the rectus abdominis. So that starts at the top here of your sternum, the xiphoid process, all the way down to your hoo-hoo or pubic bone. And the main job of that six-pack, that rectus abdominis, is to hold everything in. It also helps in bending the body forward, called flexion of the trunk. Some people are born with more little subdivisions of those rectus abdominis or semi-ulnaris. Some people have 6, some people have 8, some people even have 10 or 12. The most common is 6, those six-pack abs that you're born with. But the amount of fat you have is going to determine whether or not any of yours are visible. The rectus abdominis muscle, if you contract that muscle and you let that muscle constantly push outward, you're training that muscle to bulge outward. You've seen the people that are thin, but they have that little pooch. So it's super important every time you contract your abs, you train that muscle to go inward and not let that rectus bulge outward. You'll see people doing crunches and all kinds of crazy stuff, and their bellies are pushing outward. And when that happens, not only is that training your stomach to stick out and not look attractive, it stresses and strains the low back and pulls the alignment of your natural low back arch, the lordotic arch, out of whack. So you definitely want to make sure that you train your rectus abdominis to go inward and hold things inward and help support the spine, as was the natural design. Sequential movements like rolling back and C curves, where you sequentially fire the fibers and you train the muscle to go inward, are super good for that. Planks, again, yes, they do the superficial fibers, but you have to really make sure that you have perfect posture in your plank. If you sag and let that belly pop out just a little bit, it's a contrary movement and it becomes counterproductive. This is Pilates Master Nikki, bleh, and I'll see you real soon for another layer of real Pilates. Today on Real Pilates, we're going to talk about the bottom of your abdominal layers, the floor of your abs that are deep inside of you, known as pelvic floor. The pelvic floor muscles. So you may wonder sometimes, how come guys have an easier time keeping their abs flat and tight and girls have a harder time? There's a reason for that. So our pelvis on girls is usually less high and wider, right? Because we have to birth babies. Men have pelvises and uterus that are usually more narrow, but the pelvic bone is taller. So that narrow, taller helps give them more stability and more balance than a girl, believe it or not. But here's the killer. The pelvic floor of a girl, woman, has 3 openings, right? One for number 1, one for number 2, and the other one for having babies. Men only have 2 openings. So that pelvic floor that has one less opening, yes, it gives them greater stability. Also, all muscle fiber on both men and women is the same. What differs is the hormone level. So the testosterone, the 2 types of estrogen and progesterone. Depending on what sex you are, you're going to have different levels of hormone, and the muscle fibers are going to become more bundled and stronger or more elastic and less strong, depending on your hormonal content. It is important that that pelvic floor muscle have the right amount of tenacity, strength, yet flexibility. If your pelvic floor muscle is too tight, it affects the knees. If your pelvic floor muscle is too loose, it affects the low back, the low stomach, and eventually, yes, the knees. Pelvic floor is one of the first movement muscles that we use in our Pilates Classic C curve. Classic C curve is where you contract your ab without using the breathing and without using the butt, the hamstring, thighs, inner or front of thighs. A pure C curve is just squeezing the stomach and seeing how much you can tilt your pelvis. We can and we do add then your hamstrings, your ass, your arms, your legs, and other things when we're doing functional sequential Pilates exercises and movements. But just that pelvic tilt, you can practice seated with your hands on your lap and just squeeze the abs and try to see if you sink a little lower and you get just pure belly button line. That strengthens pelvic floor, that helps release low back pressure, and it's a lot of fun. This is Pilates Master Nikki, and I'll see you real soon for another layer of real Pilates. Today on Real Pilates, we're going to talk about your pelvis. Not Elvis the pelvis, your pelvis. Your pelvis is formed by 3 bones, the ilium, the ischium, and the pubic bone. Those 3 bones, when you're a baby, have attachments, little cartilage, that are very loose and they're not fused so that they can compress and be springy and you can be passed through the birth canal. By adolescent, those 3 bones fuse with the symphysis pubis in the front, always having a little bit of movement to it. That pelvis is the foundation of where the pelvic floor is, and it's the foundation of the whole structure of the body. In the pelvis, the spine sits in the sacral joint and comes up. The position of your pelvis needs to be nice and level so that everything else in the body can be in the right position in which it was designed so that there is not bad friction. So now, this pelvis underneath at the bottom, There are two bones. Yeah, I didn't believe there was bones in my ass, but there are. It took me like 3 years when I started studying. It was like, my ass doesn't have the bones. Maybe yours does. No, but it does. So they are called the ischial tuberosities, or the slang people call them your sit bones. And you literally sit on those bones. But those bones at the bottom of your pelvis, they move. They move with the movement of your legs. When you turn your legs out, those pelvic bones, those sit bones, those ischial tuberosities, they go toward each other, and pelvic floor sags a little, and all your organs sag a little bit when you turned out. When you turn those legs pigeon-toed and inward, it lifts pelvic floor up, and it tightens and shortens that pelvic floor muscle. When your sit bones go inward toward each other, like in a C curve, the top of your hip here, which is called your anterior superior iliac spine, well, for short, we call it ASIS. That ASIS goes a little bit outward. When your ass bones, your sit bones go outward, the top of your hip bones come inward. So we're going to talk more about that, but you need to understand that the pelvis is the kingpin of the body. We're going to talk about pelvic tilts, and I'm going to explain that totally towards you. But neutral pelvis is the ideal position from which you want to start movements, because the pelvis is going to dictate the angle of the leg bones. As your three hip bones fuse, they have fused and created the hip socket known as the acetabulum. And that's where this leg bone sits. Yes, your pelvic tilt is going to dictate the angle that that leg bone is, the knee, the ankle, the whole shebang. And so this is why core stability, core strength is critical for the health of your body. No need to worry. I know all about that, and I handle all of that in every class, so you can just hang out with me and have fun. This is Pilates Master Nikki, and I'll see you in class. Today on Real Pilates, we're going to continue to talk about the pelvis. We're going to talk about the position of the pelvis. So let's pretend for a moment that your pelvis is like this bowl, right? We talked about the pelvis, the men, the women, and all the different things about the pelvis. This little sticky I put here, let's pretend it's your belly button so that you know that it's the front of the pelvis. Obviously, your belly button is higher off the pelvic bone, but this is just so that you know that this is the front. Okay, your belly button would be a little bit higher. Okay. If you have a neutral pelvis and beautiful pelvic placement, because you do Pilates with me, you have your bowl that is perfectly level. If you have an anterior tilt, which is what we're talking about today, your pelvic bowl is tilted forward. So if you had soup in here, your soup would spill forward. It's called an anterior tilt. But when the front is down, the back part is up. This pelvic tilt wreaks havoc in the body. This makes the belly stick out. This makes the low back tight and contracted. This pushes then the chin and the shoulders out of whack, and it creates a lot of times, not always, a forward neck, which then leads to straining of the neck, sagginess, and a whole bunch of other problems. When you squeeze your butt and you don't do it in the right sequence of squeezing your stomach first, bending the knee a little bit second, and then squeezing your butt. When you squeeze your butt, it changes the angle of your ass bones and pelvic floor, and it makes it more difficult for your knees to bend smoothly without putting pressure on that knee. I can't sit here and tell you for you to cure this pelvic tilt These are the muscles that you need to shorten and these that you need to lengthen, because this pelvis is held into position by a whole bunch of muscles. You have the quads in the front, the hamstrings in the back, the inner thighs of the leg, the outer part, your IT band, your iliotibial band, and your tensa fascia lata. Then there's pelvic floor, there's quadratus lumborum. You see where I'm going with this. The muscles that hold that pelvis in perfect level position or neutral are many. And so you have to sequentially make sure that all of the muscles, ones you don't even know the names of, are at their perfect length so that they hold that pelvis where it needs to be. And that's where real Pilates comes in, because we cover all the bases. We cross the T's and dot those I's. This is Pilates Master Nikki, and I'll see you in Today on Real Pilates, we're going to continue to talk about the pelvis. So here, my little bowl with my sticky, so you know that this is the front. We said that the neutral pelvis is when your bowl is level. If your bowl is not level and it's tilted back so that the soup spills out backwards, it is called a posterior tilt, even though the front is pointing upwards. So I don't want you to get confused between anterior tilt and posterior tilt. It's whichever direction the soup would pour out of, that's where the name comes, posterior tilt. So the posterior tilt wreaks all kinds of havoc. People with posterior tilts tend to have flatter butts. Yeah. They tend to have back necking where their chins jut back and inward, where they stifle the lymphatic. Of course, they have neck pain and headaches and all kinds of issues, but they also are more prone to double chin. I don't want you to feel like any of these conditions are permanent. This pelvis is dictated by a whole series of muscles that hold it into position. People that have posterior tilts also tend to have waists that get thicker, because as the ass bones in a posterior tilt come inward too much, it puts too much pressure on the top of the hips, and those hips push outward. So it gives the illusion that they have wider waists, when in fact they don't have that. The good news is that all of these posterior and anterior tilts are fixed by Pilates. Pilates will put all the muscles that create the tilt, because it's a series of muscles. It's butt muscles, it's hamstring muscles, it's inner thigh, it's side of leg, TFL, IT, it's pelvic floor, it's quadratus lumborum, which are deep waist bending muscles. It's obliques, internal and external. So it's not proper to say that lunges is going to cure an anterior or posterior tilt. That is just way too incorrect. It's a whole series that holds your pelvis in. But don't worry, I got you covered. This is Pilates Master Nikki, and I'll see you in class. Here we go. Today on Real Pilates, we are going to talk about all the abdominal layers, putting them together, and why they're important. The abdominal layers, each one of them, have fibers in them, like grains of wood, that run in all different directions. We talked about the rectus running up and down, the transverse abdominis running across or horizontal, the external obliques, the internal obliques. We have the pelvic floor muscles, the arbitrator internus. And so each abdominal muscle runs in its own direction. And that is to help push everything inward and to help you with movement. All of the abdominal muscles integrate, interdigit with the back muscles to give stability. So everybody has to play their part. If you have one group that's out of whack, it starts to send a spiral and other muscles start to become out of whack. And then you're like, oh my goodness, I'm falling apart. I've got 10 different issues. And that's not so. Let me give you an example. When you do forward bending, right? When you do forward bending, there's a whole series of muscles that are affected in that forward bending. The back of the neck muscles, the back of the shoulder muscles, the upper back, the mid back, the low back, the glute muscles, the hamstring, the calf, the soleus that runs on the arch of the feet, and the bottom of the feet. And that's just as you're coming forward, it's a whole chain. And then as you come back up, that happens in reverse. When you arch backward, there's another whole sequence starting at all the face and jaw, the SCM, and all those neck muscles that are in the front, the scalenes, the throat muscles, the pectorals, the chest, the abdominal muscles, the quad muscles, pelvic floor is always there, the front of your shins, the top of your shoelaces, and the toes. So all of the muscles work together in a chain reaction. The old school thinking of isolating muscle is so prehistoric, it doesn't exist. To go and exercise and say, today I'm going to do, back, chest, bis, and tris is so antiquated and so not good for functional strength. Functional strength is running for the bus, picking up your groceries, picking a child up and putting them in their car seat with a bending, lifting, turning, twisting movement. These functional things that we need to do every day are for spinal fluidity, spinal mobilization, but yet with strength. Your spine has to be the Goldilocks. It cannot be too stiff. It cannot be too loose. It needs to be Goldilocks. And that's real Pilates, is the Goldilocks for your body, for your abs, and for your spinal sequencing. This is Pilates Master Nikki, and I'll see you in class. Today on Real Pilates, we're going to talk about side bending. So you may not know, when you do side bending, let's say, that's my left tattoo says, if I'm doing a side bending to the left, the contraction on this side brings the ribs closer together, but on the other side, those ribs are spacing. There is no pure side bending because as I side bend to the left and I lengthen on the right, there's a little bit of rotation. This is rotation. This is side bend. Every time you side bend, there's a little rotation. So if I side bend to the left, there's a little rotation forward on the opposite side. These are biomechanical movements that happen without you maybe conscious knowing it. When you blend movements, for example, if we're going to bend forward, if I bend forward, my ability to then rotate or side bend is going to become secondary. It becomes secondary movement, which is going to be restricted. So if I wanted to get your full side bending, I would do that from a neutral plane or from a flatness, a straightness, to get 100% capacity of that range. If I wanted to bend you backward in extension, then I would do 100% would be just that movement. But once you start to blend movements, certain movements then become restricted, which is part of functional strength, but it needs to be done correctly with the right sequence to, first of all, prevent injury, and second of all, to biomechanically make sure that your body is programmed so it knows how to move properly on its own, so that you don't wrench your back putting a sheet on. How many people do you know say, I was putting the sheet on the bed, I bent over to pick something up, I threw my back out, because their muscles were not trained sequentially for combined compound movements. And this is something that we need to make sure that we do. And that's where I come in. I've got you covered. This is Pilates Master Nikki. All you need to do is show up, and I'll see you soon for another layer of real Pilates. Today on Real Pilates, we're going to talk about spinal motion. So your spine is a series of vertebrae and discs stacked up your spine. These vertebrae, the front of them toward the belly, are designed more for weight bearing and for stress from both sides for support. The back of your vertebra are designed for the muscles to attach to them and in between them. And in between those little sprocket prongs that stick out is where your spinal nerviation, your spinal nerves are, your spinal column, and that needs to be protected. There is a infinite amount of back muscles. Let me just name some of them. There's the multifidus. There's the infraspinalis. There's the transverse spinalis. There's the quadratus lumborum. There's the semispinalis. There is the iliopsoas muscle, which is one of the strongest hip flexors of the body. And that iliopsoas muscle is responsible for the degree of arch in your low back. If your iliopsoas is too tight, your arch can be too big and your discs can be compressed. If a muscle is too tight, it is functionally weak. But if a muscle is too loose, it is functionally too weak. It's the Goldilocks. That muscle has got to be the perfect length. So those spinal muscles all interdigit with the abdominal muscles. But then let's just say on the back of you, on top of all those spinal muscles, right now you have your upper trapeze, the mid trapeze, the lower trapeze, your rhomboid, your subscapularis, your deltoid muscles. Are you getting my drift here? The latissimus dorsi, the quadratus lumborum. There's a whole bunch of other muscles that are now on top of these muscles. Each muscle has its fiber direction. Each muscle has muscles that it helps and other muscles that push against each other to create stability. The design of the body is spectacular. So it is important that all of the muscles are given the proper attention that they need. Sequencing movements is critical for the body because we do it every day. When you hold static postures, driving a lot, sitting a lot, texting a lot, you're going to start to throw the muscle sequencing from its original design out of whack. And that's why Real Pilates will help you get your muscle sequencing back in line so that you have balance between the front, the back, the top, the bottom, the inner layers, the outer layers, and you'll be happy, healthy, and swanky. This is Pilates Master Nikki, and I'll see you in class. Yes, I will.